All right, hey everyone, how's it going? I'm Dr. Brian Adkins with the Adkins Academy. I just want to give a couple people the opportunity to join us for our live question of the week. We have a great question this week on the whiteboard here. Thanks, Suzanne Ross, for joining us. But certainly, thanks a lot for all of the people who did answer. We had a lot of people to certainly submit some answers for this particular question on our Facebook on our Facebook page, as well as our Instagram and our Twitter pages, and certainly we appreciate your responses, and certainly thanks for all the engagement, Dr. Furtado, and certainly others definitely appreciate your engagement, and definitely let us know, give us some feedback, let us know what you'd like to see, if you'd like to see some more tough questions like this one, but also other ones as well. And so we certainly would love to do more questions. We do questions regarding the TEAS test for nursing school, but also the HESI exam for nursing school, but also nursing school questions like this one, but also questions for the NCLEX exam. And so we can help you throughout the entire spectrum of your career in terms of helping you to get into nursing school, helping you to get through nursing school, and certainly helping you to graduate from nursing school and pass that NCLEX the first time around. And so certainly we want to talk about questions like this where we talk about management, certainly management of a patient who's looking to get pregnant, right? She's already been pregnant before. She wants to know, what do you recommend this time around, right? And so maybe there may be some complications that we should talk about in terms of our patient, but we want to get a clear picture and certainly be able to answer the question, obviously when it comes to, say, the NCLEX exam or even questions in nursing school. Okay, and so certainly, definitely chime in. Let us know if you have any questions you'd like to see us talk about. We'd love to do questions with you. But here's our question of the week that we had this week, which is that we have a 37-year-old P1G1. So she's been pregnant once and she's delivered once, and so she had a successful delivery, and so so normal vaginal delivery, so not a cesarean section, not a complicated pregnancy, not a preterm pregnancy, and so those are all the things that we want to know. Was this a normal pregnancy, or did you deliver preterm, or how many weeks preterm, right? And all of those things. What were the complications, right? And so, before we certainly advise our patients on what we want them to do or not do, for that matter, right? And so she had no complications. So this is a pretty straightforward type of situation and scenario. And so those are the patients that we like, obviously, right? But we obviously love our patients who are challenge patients as well. And so those are the ones that we learn from and certainly learn how to manage better. And so again, a 37-year-old PG, basically PG P1G1 female, normal vaginal delivery with no complications, right? And so so she comes to the clinic seeking advice regarding prenatal vitamins. And so this is a very, very common topic, especially in today's society, understanding which prenatal vitamins are best, which ones should we take, what's good, what's not. And certainly there are lots of recommendations out there, and you obviously want to consult your OBGYN. Let me make a clear disclaimer. We are not here to give medical advice. That's not what we're doing right now. We're just going over questions and talking about how to approach these questions. And so certainly if you are pregnant, then certainly consult your OBGYN and make sure that you get their advice before you proceed, obviously, right? And so we're just, this is a very common type of question, question that you would see in nursing school, in medical school, but certainly on the NCLEX exam or the or other medically related exams. But we're not here to give advice. We're just here to talk about how to answer the question and talk about the characteristics of the question. All right, and so with that, which one of the following should you tell her? So which one of the following should you tell your patient? And so should you tell her, since you've had a normal delivery previously, there is no need to take prenatal vitamins? That's not necessarily the case. We definitely recommend under normal circumstances, certainly taking the prenatal vitamins, especially if your appetite has changed, especially in the first trimester. A lot of women get nausea, right? And certainly have nausea and vomiting. Thanks a lot of people for chiming in. Appreciate that. So a lot of people do get nausea and vomiting sometimes. So we want to make sure that she's certainly supplementing her diet or lack thereof a lot of times. And so we want to definitely recommend prenatal vitamins. Okay, and so that's probably not going to be a good answer for our patient. That's a choice A here. Probably not a good idea for our patient. All right, and so with that, given your age, and so she's 37, so she's on certainly anybody above 35. We kind of think about that number, that 35. They're kind of, the eggs are in their mature stage, and so we like to, we like to say, you definitely want to take all the precautions you can. Certainly, there is evidence that does show that after the age of 35, there is an increased risk of chromosomal abnormalities in some of the eggs, and certainly increased risk of, for example, Down syndrome, right? And so we want to definitely kind of take that into consideration. But given your age, is it not recommended that you seek to get pregnant? So it is not recommended that you seek to get pregnant. Again, as you are at an increased risk of abnormal delivery. That is not necessarily true. She's had a normal pregnancy before. She is definitely not over, say, 40 or 45 or 50, and so we don't want to discourage her from actually proceeding with the pregnancy. She has no major risk factors as far as we know, given the context of the question here, and so those are, we don't want to discourage her, dissuade her from actually getting pregnant. That's not our job to do, right? As healthcare providers. And so if your patient came to you and you're the nurse practitioner, then you don't want to dissuade your patient from getting pregnant if that's what she wants to do. She wants to have another child at 37. So that's probably not a good answer choice. And so when we talk about standardized exams, unless you have good reason and good rationale for certainly dissuading your patient from doing something that they actually want to do, or if what they're doing is harmful or dangerous to them. Obviously, if they want to, commit suicide, that's not something that you're going to recommend. If they have suicidal thoughts, if they have thoughts of hurting themselves or someone else, that's not something that you're going to recommend. So when it comes to standardized exams, these are clearly red flag type answer choices that you want to be able to identify and say, you know what, that's probably not a good idea. I don't want to dissuade my patient from getting pregnant if that's what she wants to do, and she has no major risk factors that would preclude her from getting pregnant or having a normal delivery in a normal labor process. Okay, but certainly calcium supplements or folate. So which one should we recommend to our patient? So calcium supplements are contraindicated given your history of gestational diabetes. Well, again, the fact remains that there were no complications, right? So no complications. And so certainly this gestational diabetes is in left field, given that that's not something that's supported by the question here. And so again, look for these red flag components within the question. Look for these outliers. Look for these things that do not coincide and are not consistent with the information that's presented to you. And so stick to the box. This is your box. Stick to the box, right? And so with that, we're definitely going to go with answer choice C here. So folate is strongly recommended to decrease the risk of spinal bifida, and that is very true. And so folic acid, so kind of a higher dose of folic acid, is one of the main things that you find in prenatal vitamins that you would not find in just regular adult vitamins, right? And so certainly, we think about things like DHA and certainly folic acid in terms of women who are looking to become pregnant, women who are pregnant or looking to become pregnant. Those are two of the main kind of supplements or vitamins that you want to certainly include. Okay, and so certainly, like I said, this is more for the the nursing student or the student who is looking to take the NCLEX. They're going to ask you about what recommendations would you recommend, what recommendations do you have, I should say, for your pregnant patient, for your patient who comes in with a normal situation, but also abnormal situations. Maybe your patient did have an abnormal delivery. Maybe your patient did have a cesarean section. Should you recommend to the VBAC, right? And so vaginal delivery after cesarean. What would you recommend? So these are things you want to definitely know and study as you go into preparing for your NCLEX exam. Okay, and so certainly consider us for our NCLEX course as we go through lots and lots and lots of questions, clinical scenarios, clinical questions, the do's and don'ts, what to say, what not to say. We certainly cover the new context and questions that they have for the in fact this month, so April 2019, the NCLEX is coming out with a new breakdown in terms of the content breakdown, and I'll put it up on the screen here. You can kind of see the distribution, so the new distribution of the NCLEX here. So make sure that you're aware of that. Make sure that any program that you're looking at in terms of preparing for the NCLEX, it certainly includes these concepts and these components. And so so one of the major things, and this is kind of what we just talked about, management of care. So about 20% of the new NCLEX will certainly cover that. And so management of care, but certainly a big thing, safety and infection control. So safety and infection control. And so we have lectures on Tuesdays and Thursdays, and not just lectures, but interactive sessions that we do with our nursing students and our students who are looking to prepare for the NCLEX exam. And we go over in-depth questions and strategies and topics regarding management of care and safety and infection control, but also health promotion and maintenance. Certainly a very big thing there as well. And again, our patient, our P1G1 patient, G1P1, sorry, patient certainly falls into that category of health promotion and maintenance, but also management of care. She's looking to become pregnant. Psychosocial integrity, basic care and comfort. That's another big one as well. And obviously pharmacological therapies and preventive therapies as well. And so certainly risk reduction. And so you want to make sure that your patients are not going to fall at home. You want to make sure that, if your patient is admitted to the hospital, they've had surgery, they've had knee replacement surgery or something like that. Make sure they're ambulating. We don't want anyone to get a DVT to a PE. If you don't know what that means, then certainly we'll have to do another session on that. But we can talk more about DVTs and PEs. All right, and so obviously physiological adaptation as well. And so that's the pie that's going to make up the new NCLEX as of April 2019. So as of this month, they're rolling out with a new version. So make sure that you're on top of it, because we certainly are. All right, and so we'd love to work with you. We'd love to help you to, number one, get into nursing school with your TEAS test or your NCLEX exam. But we also we would love to also help you to get through nursing school. And so if you're struggling through nursing school, a lot of these schools are accepting 45, 50, 60 people, but they're only graduating 30. Don't be one of those ones who gets left out, right? And so if you need help while you're going through nursing school in terms of help with the content and the material and strategies, and certainly understanding the material and how to apply your knowledge, then certainly give us a call, right? 301-960-4950 is our office line. You can speak with me or any of my other instructors who can help walk you through the process and help walk you through some of the strategies that'll help you to not only do well while you're in nursing school, but also help you to apply that knowledge to the NCLEX. And obviously, when you're ready, we can definitely get you past the NCLEX as well. And so feel free to reach out to me directly anytime. I'm Dr. Brian Adkins, founder and CEO of the company, and would love to talk to you, would love to certainly help you to grow your knowledge and get you into nursing school, get you through nursing school, and then obviously get you out of nursing school and get you past that NCLEX exam. We are a partner with a lot of hospitals and career organizations as well around the country. We have partnerships with them, so handshakes with different schools and colleges, and so we also help you to actually get that job as well. And so a lot of times we'll post different job postings for hospitals that are looking for RNs, or different organizations that are looking for RNs. It's not just hospitals, but it's a lot of different organizations, health insurance companies, a lot of ways to certainly utilize your degree, right? And so even when I, after medical school, I actually worked for Care First Blue Cross Blue Shield in Baltimore, Maryland, and so did some work with them. And so there's lots of opportunities for you in non-clinical work as well. And so certainly consider that as you look to move your career forward and move your career ahead. And so we're happy to help you and have that conversation with you. Certainly visit our website, AdkinsAcademy.com, and certainly feel free to reach out to us and give us a call. Again, 301-960-4950 is the office line. And like I said, reach out to us anytime. And please definitely subscribe to our YouTube channel. We're going to post this video, but also other videos onto our YouTube channel. And so definitely take a look at our at the Adkins Academy YouTube channel. Make sure that you subscribe to our channel. We would love to have you submit questions through our YouTube channel as well, and we're happy to address any questions that you have. All right. Thanks a lot, everyone, for tuning in. Thanks a lot, and we will definitely see you for the next question of the week. All right. And so until next time, we'll see you. All right. Thank you.